Thank you so much for taking the time to share a little bit of space with us to talk about how to be prepared for colorectal surgery fellowships. I'm Dr. Minerva Romero Arenas, and I'm the president of the Latino Surgical Society. The Latino Surgical Society was established in 2017 to help nurture, boost, and encourage the development of Latino surgeons. With that, I'd like to take the opportunity to introduce our co-moderators this evening. Dr. Genesys Giraldo is a PGY3 resident. She's originally from Miami, Florida. She completed her undergraduate studies at the University of Florida and is a resident at Washington University in St. Louis. She's currently a T32 research fellow investigating how the tumor microenvironment in rectal cancer may be predictive of the response to neoadjuvant therapy. Thank you, Dr. Giraldo, for joining us tonight. Co-moderating is going to be Dr. Jazlyn Merida. She is a PGY2, also originally from Miami, Florida. So we've got a strong Florida presence tonight. She completed her undergraduate studies at the University of Florida, and she did a Master of Public Health at Florida International University. She completed medical school at the University of Miami, where she also obtained a Master's of Business Administration and is now a resident at the University of Miami, Jackson Health. They will be helping guide today's discussion. And with that, I'm happy to turn it over. Thank you for taking the time to moderate for us today.
Thank you so much, Dr. Romero. Welcome, everyone, and thank you again for joining us today. We're so honored to host this session and have an incredible group of panelists joining us to share their experiences and insights today.
I'm going to begin by introducing our first panelist, Dr. Ana Sofia Ore. Dr. Ore is a colorectal surgery fellow at the Mayo Clinic in Rochester. Dr. Ore was born and raised in Lima, Peru, where she completed medical school. She then moved to Germany, where she completed a Master of Science in Clinical Research. Afterward, she moved to Boston, where she concurrently completed a research fellowship at Beth Israel and an MPH at Harvard Chan School of Public Health. She then went on to general surgery residency at Beth Israel, where she completed a postdoctoral research fellowship focusing on translational colorectal cancer research and also served as administrative chief resident. She's passionate about health disparities and improving access to care and surgical outcomes in underrepresented populations, specifically patients with limited English proficiency. She's the founder and co-director of the Colorectal Surgery Latinx Clinic at Beth Israel, which aims to serve the Latinx population of Boston by providing culturally competent, tailored colorectal surgery care for patients with limited English proficiency. After graduating from her fellowship at Mayo in July of 2026, Dr. Ore will return to Beth Israel Deaconess Medical Center and Harvard Medical School to join the Division of Colon and Rectal Surgery as faculty. Thank you for joining us.
We also have Dr. Zarate, who's a colorectal surgery fellow at Mount Sinai in New York. He's originally from Mexico City, but he spent some time in Argentina and China growing up. He completed his undergraduate degree at NYU, splitting his time between their new campus in Abu Dhabi and their main campus in New York City. He later went on to medical school at Washington University in St. Louis, where he also completed general surgery residency. He's most interested in robotic oncologic resections and survivorship, particularly as it relates to sexual function after pelvic surgery. He's also interested in anal dysplasia screening and management of anal cancer in high-risk populations, especially queer patients and those living with HIV. Outside of that, he's interested in surgical ethics and surgical education, and a lot of his research has focused on recruitment and retention of racial and ethnic minorities. Thank you guys for coming.
Yes,
Thank you for
thank you.
having us.
Thank you. We're super excited to be here.
Thank you for joining us today and giving us some of your time. I know you're both busy fellows, so we really appreciate it. And we're excited to hear more about your journey and how you got here and your future career aspirations. We'll begin with a few key questions, but for the members in the audience, please feel free to submit questions in the chat and we can get to them throughout the webinar or at the end. We'll leave some time. So starting with Dr. Ore, what inspired you to pursue colorectal surgery?
That's a great question. I think that when I started residency, I knew that I wanted to do something cancer related. When I started intern year, probably not the greatest of ideas, but my first rotation was Surg Onc HPV. And, it all seemed very like pancreatic cancer oriented, gastric cancer oriented, and there weren't a lot of wins. And then right after that rotation, I got a colorectal rotation, where you also had the multidisciplinary care. You got to do different types of surgeries, open, robotic, laparoscopic. I saw that the faculty that I worked with had good short days in clinic. They could do outpatient procedures, and then they had big days with big pelvic open cases. And I really liked the combination of all of those things. And then later in residency, it really started aligning with my research interests. Like you mentioned, I'm really passionate about patients with limited English proficiency and how to improve surgical outcomes. And colorectal cancer rates are rising, especially on young populations. And Boston's Hispanic population was growing, and so I really took it as a project to try to like increase screening rates and try to improve the outcomes for that specific group. And I think that that kind of tailored the whole thing together and made it like the perfect specialty for me.
That's wonderful. And I think probably so many of us can relate to enjoying the different aspects and different settings where you can practice colorectal surgery and tailor your practice. What about you, Dr. Zarate? What was there a specific moment where you knew you wanted to do colorectal surgery, or was it more of a gradual decision?
It's funny because I actually had a pretty similar, journey of realization as Dr. Ore, which is, we are the same, year, so we interviewed the same year, and we overlapped in a lot of the same interviews, but we never had the chance to like talk about our backgrounds, and so it's funny to only now come to realize that we had, very similar journeys. I came into residency thinking I was going to be a pediatric surgeon because I really liked, the idea of, you know, building new organs out of, from scratch essentially. And once I rotated through it, I kind of realized that it wasn't for me, working with kids and working with parents, it sounded more fun in theory than it was in practice. And so that's how I came to surgical oncology, which is what I did on my research time. And I thought I was going to be a pancreas cancer surgeon because the idea of taking out a tumor and then putting the pieces back together was what really interested me. And very similar to what Dr. Ore was saying, the more that you talk about pancreatic cancer, the more you realize that the outcomes are unfortunately quite poor. And so my research focused on rehabilitation to kind of optimize patients to bring them to the operating room um, so that they're, more likely to succeed. And even though we were able to demonstrate improved surgical outcomes, the outcomes are still not great. And so my mentor, to his credit, was the one that suggested I consider, colorectal surgery, and he connected me with the colorectal faculty at our institution. And it was a much better fit for me. It was, cancer surgery where the outcomes were much better. It still has a really creative, reconstructive aspect, and still has all the aspects of oncologic care that I think attract both me and Dr. Ore, being able to see somebody from diagnosis to treatment to then, onto their surveillance and their survivorship, which is, has become a new interest for me since starting fellowship.
Yeah, I think it's excellent that you both had a very similar path. And I think for a lot of us junior residents, it does come down to appreciating if we're interested in the oncologic patient population and to what degree do we want to be involved in that. So taking it
I,
forward, oh, go ahead.
sorry to interrupt, but yeah, to that point, I think, even though, and Sofia and I are both very interested in cancer, the cool thing about colorectal surgery is that it offers a really rich breadth of disease, and which is not super common in subspecialties. And so while there's a really large oncologic component to colorectal surgery, the amount of benign disease is very varied and also very challenging surgical problems to fix. So if cancer's not your number one thing, there's still a lot for you to do in colorectal.
Yeah, the diversity is key for the specialty. I agree. So, what steps did you take during residency to prepare for fellowship? And both of you, since you're only 4 months out from becoming attendings, taking it a step further, what steps are you taking now to prepare for that attending role? We'll start with Dr. Ori.
Yeah, no, I think that's a great question. I think during residency, and I think it's hard because I think people come to the realization that they want to do colorectal at different stages. I was very fortunate that that happened intern year, and I had really good mentors. And so the colorectal surgeons at my institution were very passionate about taking us to AACRS, the annual conference, like from intern year, and kind of showing us what that world looked like. And let me tell you, if you've never gone to one of those AACRS conferences, you go once and you're like, this is the best thing ever. These are my people, and you want to go every year. And that's basically what happened. And, that makes you want to move, like work towards the goal of, okay, every year I want to send a project. I want to make sure that I'm keeping doing research because I want to go to this meeting and I want to keep meeting the people in the society. And I feel like that was kind of like things slowly aligning of like, okay, I'm working towards going to the conference this year, so I'm going to keep doing research. And then as I started my research time, okay, great, I can now work more on colorectal research, but at the same time, I have a little more time to give back to the society. And so that's when you start joining committees in the society. And that also kind of builds up. And I think that the colorectal community is very small. And so you start meeting the people that, are the different fellowship program directors that you're going to meet 3 years later down the interview trail. And so it's very helpful if they've seen your growth and kind of your trajectory towards like that goal during residency. And I think that that's also how you write that application story of like, this is when I realized I wanted to be a colorectal surgeon, and look at how I've been growing every year to get to that goal. And then just to very quickly answer your question for the faculty part, terrifying, I'm not sure yet. I think that one of the nice things of knowing where I'm going to work is that I'm able to start writing grants and like planning projects. Very excited to go back where I trained. So I get to work with the residents that were my friends. And then so kind of like trying to understand, okay, this is how I'm going to do the surgery. This is the part that I'm thinking of, like, this is how I'm going to share this case with the chiefs. This is how I'm going to share this case with the residents. And so it's very exciting, but I think there's probably more to come. So I think that that question can be answered in the future for sure.
Definitely. What about you, Dr. Zarate?
I agree with everything Dr. Ore said. I think it's hard to realize the importance of networking in colorectal. Like she was saying, like it is a very small community, and everybody goes to ACRS. And not only is it a really fun meeting, but also it allows you to connect with these people face to face. And you'll come to realize as you interact with more people on colorectal that I think the kind of people that are attracted to colorectal tend to be a little more laid back, and and so I think that everybody is very willing to give you their time and their expertise, and so ASCRS becomes like a really nice platform for you to become plugged into the community early on. And like Dr. Ore was alluding to, there are a lot of opportunities for you to become involved, even at the medical student level, with with a variety of projects that exist. So there's a lot of research committees. There's like a young surgeons committee. There's like an education committee where medical students and residents can kind of help craft some of the educational resources that the ACRS puts out. And so there's a lot of opportunity to get involved early on that then opens a door for future conversations. And then you can show up to your fellowship applications kind of like already kind of knowing some folks. I think the ACRSU committee, and then there's like a video education committee. Those residents are very active in both of those committees. It kind of puts you in touch with the people in the community, in the AS colorectal community, who are particularly interested in education. So those are key contacts for you to be making early on. With regards to the latter part of the question, still kind of yet to be seen how prepared I will be for attending Hood. But something that I was trying to be pretty intentional about was trying to complement the training that I had got previously. So, as being at WashU, that WashU has a really strong history of, large open resections, and really strong history of, hand-assisted laparoscopy, which is, has to do with the lineage of all of our attendings that, come after Leahy. And so I looked for a fellowship that I felt was gonna, not fill in the blanks because I don't think I was weak necessarily, but like try to, gain more exposure to things that I hadn't seen as much of in St. Louis. And so I wanted to be somewhere where I saw more IBD. I wanted to be somewhere where there was a heavier emphasis on robotics. And so that's something that I think has prepared me now that I'm, in the uh, career fair part of my uh, journey to be able to sell myself as a well-rounded surgeon and somebody who has a really wide arsenal of techniques and skills that makes me marketable, and also like a partner that people are going to want to add, somebody that can add to the group.
Those are really great points. I think it's valuable for us to think about when we're applying to fellowship, how the fellowship program will complement our skills and being self-aware of your training and where your strengths are and not going where maybe is the most comfortable or similar to your training, but somewhere that complements it. That's a good point that I personally hadn't thought of. So thank you for sharing that. Um, Going back to the conferences and uh, the committees that you guys were mentioning, do you think that those would be a good starting point for someone who may not have like a strong colorectal department at their home program and is seeking mentorship during the process? Okay, I see you're not you nodding, but I know that that's something that some applicants are concerned about if they don't have a mentor that they've been working with for some time.
Yes, the ASCRS has a mentorship program that is specific to the population you're describing. And so as a resident who's going to be applying to fellowship, you can sign up to be part of this mentorship program. The specific name of it escapes me, but if you go on the ASCRS website, you'll be able to find it easily, because it's going on for a couple of years now, where you basically sign up as somebody who's, up and coming fellow, and they ask you about, the exposure that you've had. And if you come from a program that doesn't have like a home colorectal division, you get prioritized to be paired with a faculty mentor, um, uh, to guide you through the conference, so like a buddy thing, and then also to guide you after the conference and can be available to you as a mentor for beyond that.
That's wonderful. I think that speaks to the nature of the field and everyone that is a part of it. Um, and during the application process, did you face any challenges or things that you weren't expecting that you could share? We can start with Dr. Ori.
Yeah, definitely. And I think we can make this a little interactive because I think, the colorectal fellowship interview trail, I think as we were going like forward in residency, I think we both realized that the rates were dropping. And so I think that one of the things we faced as we started fellowship interviews is that everybody was terrified because I think that it became definitely more competitive. I think people started realizing how, such a great versatile field it is. uh, I would say things that surprised me during the trail, you become really good friends with everybody you apply. You realize that it's a very specific group of people that are interviewing in each of the hospitals. And so, well, Dr. Zarate and I interviewed in many, many hospitals at the same time. And it's because people within the same profile kind of have the same group of interviews. I think that one of the things that I realized during that application season is that it's very different to the residency interview trail in which you are very much selling yourself. It's very much of the programs actually sharing what their experience is and if you would be a good fit for them. And they really are trying to sell the program to you. And I think that one of the reasons that is because colorectal fellowships, they're very different. And I think that there's so many things that you find out during the interview trail that then eventually, how many calls are you taking? Are you taking in-house call? Are you taking home call? What is the distribution, as Dr. Zarate mentioned, on like robotic, laparoscopic, open surgery? And so those are things that you need to be aware and kind of like ask during the interview trail. How many fellows are there? What are the numbers? And if you're interested in specific procedures, some fellowships have more pouch numbers versus others. And just to get a sense of like what is really what you're going to do and what are the procedures that you're not going to be doing. And programs are very much open about their experience, and the fellows that currently are in the programs are also very open about their experience. And so I think that the openness from everyone really surprised me. And I realized that it's really good to just ask all the questions just to make sure that you actually find that right fit for you for a fellowship.
Yeah, absolutely agree. I think it is such a different ball game compared to residency interviews. Exactly like Dr. Ora was saying, it feels very formal when you're doing residency interviews, and it feels like there's a distance, a little bit between you and the people that are interviewing you. And I think that some of that has to do with just like volume, right? Like they're interviewing like hundreds and hundreds of residents for, their eight, six, seven, eight spots. But for fellowship, there's only 100 of us total, essentially 100 and change. And, a lot of programs will have, one, two, three, somewhere between them. There are bigger programs like the Order will be able to tell you, but in majority, you have somewhere between one and two fellows. And so, as an attending that who works at a hospital with a fellowship program, what you really want to know is, can I hang out with this one kid for the next year? And so, the questions that people ask you aren't so much like, oh, tell me your opinion about sequencing for rectal cancer. Like they're asking you like, what do you like to do in your free time? Or like, what do yeah, like what are you like as a human? Just because the sheer amount of time you're going to be spending together is so much more compared to residency, and there's just like fewer people total, and so everybody assumes competency from like a surgical point of view, and that's a knowledge base, and so it becomes much more about the vibes, as the youth say. It's more about, do you think this is going to be a good relationship that we're going to be able to have together or not? And so the interaction is just so different. Most of them were about my hobbies, what I did outside the hospital. And a lot of it is, where do you see your career going? But not as like a trick question kind of thing, more of like a, hey, how can we help each other? And so it's just very different. It was a little bit jarring for me at first. People wanted to know, like, what kind of cookies I like to bake, because it's somewhere in my CV I said that I baked, like, so.
What kind of cookies do you like to bake?
I would say my signature cookie is an Earl Grey cookie with a white chocolate shell.
Ooh, that sounds
Yeah.
delicious.
Yeah.
That sounds really good.
Mhm.
So you kind of hinted at this, but what do you think matters more than applicants often realize, like in this process? And maybe what matters less than they think it does?
I think that's a really good question. I think that, and I don't think it, I think that applicants are so similar. Like, for example, upside scores, I think that matter within the range of reason in the sense of like, as long as you don't have incredibly low upside scores. I think that nobody asked me ever about my upside scores on interviews. And I agree with Jorge. Like, I got more questions about my dog and like cooking Peruvian food than any kind of like clinical judgment question. Um, so I think that matters of like, what do you like to do? And if that city and that group is actually going to be compatible with you. Because if you say that you love the beach and you wouldn't see yourself living in a place where 9 months out of the year it's winter, hence where am I right now? I think that you wouldn't come to Rochester. And so I think it's a lot about that fit. Um, I think letters from your, mentors or people you work with matter a lot. I think that, as we alluded before, it's a very small community, and so everybody knows everyone. And so reading a letter from somebody that you respect from the society matters a lot. And all those committee kind of like research experiences do matter. I think that now that the letters of recommendation are standardized, it is a little bit tricky because so now for people that don't know, the colorectal fellowship letters are standardized in the sense that the first page, it is just very specific questions where each of your letters can grade you from like competent to like, 50%, 75%, top 5% that I've ever worked with. And there's no room for description, there's no room for any comments. And then there are three open-ended questions in the second page where they can elaborate a little more. But because of the new structure, what they put in those open-ended questions become really important, because that's really where they can actually elaborate on how they know you and how you are as a person and why you should go to this fellowship. Because that first page becomes very much of everybody is the top 5% for everyone. And so it's really hard to judge. And so I think that that's when all the other things in your CV become really important.
Dr. Zarate, what do you think?
Yeah, I would agree that the networking aspect is probably a bigger deal than I realized necessarily. And so not only having letter writers who are sort of active in the community will help you, but you know, I don't know whether it's right or wrong. I think is a conversation for a different day. But like people will give each other phone calls afterwards, and so, having, an attending in colorectal be able to talk to whoever interviewed you and say, oh my God, yeah, like Anna Sophia is like the best candidate I've ever seen. That kind of stuff matters way more just because colorectal is such a small world. I would say research, academic productivity matters, but it almost doesn't really matter if it's colorectal specific or not, or at least that was my experience. All of my stuff was pancreas cancer, and I was worried that was going to hurt me in the application cycle. But I think the point is whether you can carry a project from beginning to end rather than, what you were looking at specifically. People did ask me like, oh, well, what are your research interests in colorectal? Since, I didn't have that much of, as much of that on my CV. I was helping pancreatic cancer, but I was able to demonstrate that I had like, was able to see an idea from its inception to its, to bring it to fruition into, a manuscript. And I think that that's what people are really looking for more than anything else.
Excellent points. I see that Dr. Garcia is here, so I'm going to briefly introduce him and then we'll try to catch up on some questions. But for those of you in the audience, Dr. Garcia is a colorectal surgeon at the Oregon Clinic in Portland, which is the main location for the Oregon Health and Science University Colorectal Surgery Fellowship Program. He was born and raised in Venezuela, where he earned his medical degree before moving to the United States. He spent several years in Miami conducting research and completing his USMLE examinations prior to entering surgical training. He completed his surgical general surgery residency at Johns Hopkins Hospital, followed by fellowship in colorectal surgery at Brigham and Women's Hospital. Thank you for joining us. Welcome. One of the first questions that we asked, and just, because I think it's a great question to help us get to know you a little bit better, is what inspired you to pursue colorectal surgery, or was there a moment that you knew? Was there a click?
Hey guys, sorry I'm late. I was called into the war and I was having technical issues afterwards, but I'm happy to be online now. Thanks for inviting me over. I mean, what led me to do colorectal initially, as I went into residency, I thought I wanted to do transplant, and it was to answer that question. It was kind of second year, third year. I did a lot of multiple colorectal rotations, and as I'm sure many people who go into colorectal by now, have realized, I like the versatility, all the difference in approaches, huge open days, laparoscopic, minimally invasive, robotic, constant stuff, endoscopy. You're treating with benign disease, oncologic disease, which is, ever so changing nowadays. Overall good outcomes, which was something that as I went through residency in order specialties, Dr. Zarate, you mentioned pancreas cancer. I realized like as much as the surgeries are technically very demanding and very fulfilling, I did not enjoy that aspect of kind of the outcomes. So also good job market, fell within the sort of umbrella of general surgery training. I have my little spiel that I tell general surgery residents as to what, even if they're thinking about doing general surgery, why they should be colorectal surgeons. But in short, you are a minimally invasive specialist. You can do pretty much everything in the abdomen. You can do the pelvis, which is kind of what the thing that differentiates us from general surgeons. And you're both an surgical oncologist and, a quote unquote ACS surgeon if needed. So all those things put together kind of made more sense as I went through training. And that's why I decided to colorectal.
That's wonderful, Dr. Garcia. Thank you for joining us and sharing. I think we had touched upon the versatility of the field, and I think it's a great point to compare it to general surgery as us that are in the audience, and Genesys and I were in our general surgery residency. So, in terms of when you went through the application process and your course, what do you think are qualities that fellowship programs look for in strong applicants? And if you were advising someone that was early in their training, what are some high yield things that you think they should focus on to become a strong applicant?
Yeah, so I mean, I think, and I think Jorge touched on this as I was logging on. Um, I'll start kind of backwards. Things to do early on is as early as you make the decision, try to start connecting with people within the colorectal sort of society, colorectal wall in your own hospital, and very be verbal about your interest and show interest, be proactive about sort of chasing opportunities, chasing kind of relationships, because that's well appreciated. And the reason I say this is because I started deciding I wanted to do colorectal in second, third year, and very early on, I started voicing that interest within, my residency, and that allowed me to, throughout the 2 years from second to fourth year, because I went straight through, it allowed me that when the time came and I was like, hey, the application is finally here, the one that we've been talking about for years that I'm interested in, going into, they felt very strongly about, yeah, let me also try to help you because we've been talking about this for a year. I've seen your interest. We worked on multiple projects together. It allows you, the earlier you start developing those relationships, the better that the people that are in positions to help you, which is the reality of things, they feel more comfortable doing so, as opposed to if unfortunately, which happens sometimes, you decide late in your residency, oh, I think I actually want to do colorectal. Some people might be like, yeah, I mean, Jazlyn, I know is excellent, but I actually never talked to her. So how would I really pick up the phone and talk to my colleagues and recommend her if all I've heard is she wanted to do X and Y? And so that's more of a logistics and try to kind of be proactive as early as you can. Um, and the other aspect of the question about what makes strong applicants, um, I mean, I think applications, I think are a very kind of dynamic thing in the sense that it's not just one thing that's gonna make you strong. You need to be strong clinically. You need to be um, good from a humane standpoint because that's what people in your hospital will see, who are the people that will be writing those letters of recommendations. You need to work hard to score your to ace your exams, so the people that you're going to go train with know that you're also academically very good and will do well on your boards, which is something else that fellowships worry about, making sure that their pass rates are good for their fellows. And depending on where you go, your academic profile needs to match that place. Meaning, if you think you're going to go into the community and have a more community-based practice, uh, it's probably okay if you're going to have 30 publications and 3 grants or whatever. But otherwise, if you think you want to go into an academic place, but have never either had the interest, and sometimes it's just opportunities that you have not had to develop those academic interests, that might not match, so to say, and that's why in some instances it's just not a good fit. Um, so if you do have an academic interest but you haven't had the opportunities, be very verbal about that and be honest and transparent about it. Like, hey, this is like me, for example, to give you guys an example about me, I was an IMG. I started as a preliminary resident. I was offered to go straight through. I was not offered to have the opportunity to do research, like academic dedicated research time. And that was something that coming from Hopkins, as I went to the application, I saw it's like, oh, they might see this as a problem. But someone recommended at some point, which I appreciated, just to be very clear about why that happened, what led to the point that me graduating from Hopkins and so on, I didn't have X, Y, and C academic development time. Just make it make sense essentially. But yeah, that's comes to mind right now.
And then if I can just add something, because I think that Dr. Garcia actually touched base on a very important point, is that both Dr. Zarate and I think that we're, very much describing of like our interview experience in like the academic programs, because we both came with, protected research time and like academic research. but there are different types of programs for everyone. And I think that that's where Dr. Garcia's point of like being very intentional in your personal statement, being very intentional in your letters of people that know you, kind of explaining what kind of practice you want and what kind of fellowship you want is really important, because there's many people that come from academic programs that are not interested in, the old kind of like renowned academic programs, but they want good training. And I think there are so many colorectal programs that give you amazing training and are more clinical oriented. And so it's a matter of you just stating, what your goal is and why, and just making sure that your application aligns with that. But there are different programs. So I don't want everybody to think that, everybody needs 30 publications, 40 publications to match into colorectal. There are different types of colorectal fellows.
Yeah, absolutely. Thank you. I think as we all hear that it becomes more and more competitive every year to match into colorectal surgery, it feels that way, but it's important, like we also mentioned earlier, to think about the end goal and your practice goals ultimately, like what you want your practice to look like, and kind of align your fellowship with that, and maybe not just a ranking program list or something along those lines.
Yeah, and Jorge, you answered a question in the chat, but just to get Dr. Ore and Dr. Garcia's input for applicants that are not coming from strong or programs that don't have a strong colorectal surgery department, and there are limitations to, going on an elective, it might be far. In terms of letters of rec, and speaking to your surgical and clinical skills, does it matter not being supported by a big name in colorectal surgery? And how do you recommend that they navigate this?
Uh, oh, sorry. I mean, to that I say, I think you can think of it the other way around. Don't think not having someone who's a strong or a very renowned name in colorectal will not hurt your application if you're still, like I said before, if you have a well cohesive, strong, otherwise kind of 360 application. Use what you do have in your advantage, to your advantage, and use the people that you have, create relationships with, use the network that you have within your reach. Like these webinars, all the names that and then the people that are here because we want to help in one way or another. Use what's within reach, and whether there's going to be doors that might be open or not because of the pace you are, most likely, but that applies to everywhere. So I wouldn't get in your head because of that. I would focus on using what's within reach, your colleagues, your mentors, these types of opportunities, the society webinars, the society activities, to be as proactive as you can so you kind of overcome whatever obstacle the environment that you're in has for you.
And just to add to that, I think that, a very strong letter from a program director that knows you for 5 to 7 years, or a strong letter from a chair that has seen you grow since intern year, is as strong as somebody like a big name in colorectal, as long as they give like, a very thorough, accurate description of who you are. And just to give you an example, for example, I applied with 2 colorectal letters, but I had a letter from my chair and a letter from my program director who are not colorectal surgeons. And I got a lot of compliments on those letters without them being colorectal, just because they did a really good job of describing because they know me well.
Yeah,
Absolutely.
half of my letters were also not colorectal.
Right. And like Dr. Garcia also touched upon, there is an overlap with general surgery and the other kinds of ACS type cases. So there are transferable skills that I think that program directors or other specialty attendings can speak to, hopefully for people that are in programs that don't have a strong colorectal department. But in terms of continuing on the interview trail and through the fellowship application process, what are questions that you think applicants should be asking the programs throughout their application cycle?
Um, I think so. So I think that you're going to be well trained no matter where you go. Like every program is going to give you the skills that you need. But if you know that you want to do something in particular, in your career, then that's kind of where you need to be a little bit more discerning about where you end up. So asking about the distribution of, like what comes through the door, right? Like it's not going to be the same everywhere. There's going to be places that are going to have a heavier emphasis on cancer than others, heavier emphasis on IBD than others, and a heavier emphasis on robotic surgery compared to others. I would say that the all programs have to have some, because everybody needs to get a minimum amount of numbers. But if you are like the IBD person and you want to be doing pouches, you can't just go anywhere. You have to go somewhere where there's a lot of IBD and a lot of pouches, which is not everywhere. But I would actually kind of try to caution against that. I think that you should try to get the most well-rounded training you can. With the only exception that I alluded to earlier is like I knew that I had not had as much robotics as I wanted to in my residency, and so I prioritized places where I was going to have a lot of robotics because I felt like I wanted that. But other than that, I think that the training you're going to get is going to be great no matter where you end up.
Just to add to that, I think that some of the questions really rely on the questions you ask the current colorectal fellows. I think that they're very honest and they give you their perspective. And we touched a little on this before. There are like single fellow programs, and then there are large fellow programs. So, for example, in my program, there's 5 fellows, and so you want to ask how the relationship between the fellows is. Is there like an adequate distribution of cases? How do they get along? Just to figure out like how the dynamics of the program works. And so I think that current fellows are really a really good asset to just get a sense of what the program is like.
Yeah,
Great.
I think to what Jorge said, it depends on what you want, on what you see yourself. The kind of cliche question, where do you see yourself in 5, 10 years? You need to actually ask where you where you wish and want to be after fellowship, so you know which kind of fellowship is best for you. So it sets you up to us at least, which is what I tell applicants for residency and everything. It's all about having options as we go through these match processes and these application processes. You want to have all the options at your disposal. So if you think about where you want in your career, you want to think about what you want. You want to think of which places will give you the most amount of options to really develop those things. Then life will happen, and who knows. But at least you want to have all the options that you can possibly have.
Yeah, and that's a perfect transition to the faculty question. So when you're looking for a faculty role, as all of you have or are in the process of doing, what are some factors that you're prioritizing?
I think we kind of alluded to that at the beginning of, depending on where you see yourself. For example, like I knew that I wanted an academic institution and I knew that I wanted to do research. And so when I was having those conversations, I wanted a place that was going to give me, some protected research time to be able to start my career, writing my grants, being able to continue my research. And so I think that for me was one of the important things in that conversation. And then at the same time, depending on where you train and what your skills are, like if you know that you're passionate about cancer, you want to go to a place where you're going to have opportunity to build, that cancer practice. But if you're, interviewing at places where they're like high IBD centers and the expectation is for you to do mostly benign disease, then you're not going to be able. So I think it all depends on. There are a lot of places that are looking for well-rounded colorectal surgeons because you do a little bit of everything. But I think it depends on that, your clinical interest. And then if you have any research interest, to make sure you have those discussions early on of like, having that protected time to be able to develop your research, because the expectation of you having to do research without any protected time is almost impossible with a busy clinical practice.
That's a good point. Dr. Zarate, what do you think? I think you're muted. Oh, he might have froze. Well, we do have a question in the chat while we wait. For those of you that have had experiences with J1 visas, what was your experience with that and with interviews?
Well, I went through training with a J1. Most university-associated places will have no issue continuing the J1 visa. faculty positions, and that's a different story to kind of what comes after. And in comparison to what Anna mentioned, in my case, one, two, and three on my priority list for when I was looking for jobs was my visa. So that kind of shaped how I looked and where I looked and so on. Um, so the opportunities will depend on what your priorities are, whether it's visa, clinical aspect, research aspect. In my case, it was visa number one, two, and three, and then came clinical interests, and I happened to kind of find a spot that hopefully that thankfully filled the two of them. But you have to write down whatever 3, 5 things that you think or potentially think are non-negotiable, and prioritize those things, and then you'll have a few whatever amount of jobs to interview at and have opportunities, and sometimes you have to quote unquote sacrifice one over the other. That's why you have to prioritize.
So Jorge got disconnected, but I'm going to add his email to the chat. If anyone wants to reach out to him, he's happy to answer any questions or be a resource.
Yes, and thank you both so much for sharing. I think hindsight is 2020, and so it's very valuable for us that haven't gone through the process yet, but are about to hear the things that you all have learned and what you think is important now that you're there to consider. So I also think that speaks to the importance of mentorship, and we really appreciate you being here tonight. Any final advice you would give to residents or students interested in the path of colorectal surgery and on the path towards application?
Yes. I think there is a home for everyone in colorectal. I think that you should talk to the people around you, talk to current fellows, use the connections that you have, like we said before. Please feel free to email us to get a perspective of what kind of programs are there and which one would align with your goals. Start thinking on the application early. As you know, colorectal fellowship and is a chief year application. And I think that the timeline is very tight. Like everything happens super fast. You start submitting applications in July, you interview September, October, and then you match end of October. And so having everything ready from early on is very helpful, just to make sure that you have time to have those conversations with your letters and kind of like build your CV. Make sure to always keep in mind when the colorectal conferences are, usually, May, to make sure that, you have your project submitted by then and make sure that those things are able to make it on time for your application.
Absolutely. Those are great points. Thank you. And Dr. Garcia?
Yeah, many things we've covered, but just stay focused on what you have done and what your interests are and what you actually want out of fellowship and afterwards. And be cohesive when you go through the interviews. There's no trick questions, there's no tricking anyone. You want to be in a great place. There's what Jorge mentioned before, there's most of them are amazing places to train, and nowadays, thankfully, uh, almost everywhere has great training everywhere. Doesn't matter where you are, but I think just stay focused throughout your application when you go through the interview process about what your kind of CV, personal statement, and what you are saying in interviews, and just make it be cohesive and make it make sense. When there are discrepancies, that's when some that we're nervous or whatever, and things might not come out as we wish. But just focus on what you all have always wanted, what you worked so hard, and what you wish to you get out of fellowship and afterwards. And people will notice. People notice when people are generally interested in the field, and people notice when people are generally passionate about what they want. And that shows.
Absolutely. Thank you so much. Thank you to our panelists for sharing your experiences, and thank you for everyone who joined us today. We hope that this session was helpful and informative, and our panelists have shared their contact information in the chat. If there are more questions that pop into your heads and you want to reach out, On behalf of the Latino Surgical Society, thank you again, and I hope you all have a great evening. Buenas noches.
Bye, buenas noches.
Bye. Thank you.